SEROQUEL XR, Quetiapine fumarate. Much remains unknown about the neurochemistry and pathogenesis of the depressive episodes of bipolar disorder and how medications work to alleviate these symptoms. There are several hypotheses for the physiological basis of bipolar depression. Monoamines, for example, serotonin, norepinephrine, dopamine, and their receptors have been implicated in the neurobiology of bipolar disorder. Some research indicates that a deficiency of one or more of these key neurotransmitters of the central nervous system may underlie the depressive symptoms of bipolar disorder. It is generally accepted that the various antidepressant drugs act to restore the balance of the levels of key neurotransmitters of the central nervous system, including norepinephrine and serotonin. But how? The putative mechanism of action of a number of antidepressants is the inhibition of neurotransmitter reuptake from the neuronal synapse. Reuptake occurs when transporters located on presynaptic neurons facilitate the transport of neurotransmitters from the synapse back into presynaptic neurons, thereby limiting their availability for binding and activation of postsynaptic receptors. When reuptake is inhibited by an antidepressant drug, these neurotransmitters remain in the synapse longer, available for binding and activation. This is how reuptake inhibiting antidepressants are believed to enhance neurotransmission. It is important to note that SNRIs are believed to work through inhibiting the reuptake of norepinephrine and serotonin. Unlike SEROQUEL XR, SNRIs are not approved for use alone to treat bipolar depression, and they may increase the likelihood of precipitating a manic episode. Quetiapine is the active agent in SEROQUEL XR, an atypical antipsychotic agent that is approved to treat bipolar depression. A frequently asked question is, how can an atypical antipsychotic agent be effective in treating bipolar depression? As with other agents in this class, the mechanism of action of quetiapine is unknown. However, the efficacy of quetiapine in bipolar depression may partly be explained by the high affinity and potent inhibitory effects that norquetiapine, the active metabolite of quetiapine, exhibits for the norepinephrine transporter, or NET. A deficiency in norepinephrine has been shown to play a role in the pathophysiology of bipolar depression. NET is a plasma membrane protein located on the presynaptic nerve endings of neurons. NET limits the longevity of norepinephrine in neuronal synapses by enabling its reuptake by the presynaptic neuron. Quetiapine's major active metabolite, N-disalkylquetiapine or norquetiapine, exhibits a high affinity for and has potent inhibitory effects on NET. Quetiapine also impacts other neurotransmitters. The mood-stabilizing properties of quetiapine in bipolar disorder and schizophrenia are believed to be mediated through a combination of dopamine type 2, D2, and serotonin type 2, 5-HT2A, receptor antagonism. Antagonism by quetiapine and norquetiapine at receptors other than dopamine and serotonin with similar or greater affinities may help explain some of the other effects of quetiapine. For example, antagonism at histamine, H1 receptors may help explain somnolence. Antagonism at adrenergic alpha-1b receptors may help explain orthostatic hypotension, and antagonism at muscarinic M1 receptors may help explain anticholinergic effects. SEROQUEL XR is approved for bipolar depression as monotherapy. Its proposed mechanism of action may help explain how this atypical antipsychotic helps stabilize mood in bipolar disorder.